Hey there, YouTube family. My name is James, and I wanted to welcome you to the Everything Healthcare channel. In this video, I wanted to go through and explain all the different types of healthcare workers, what they do, and why they're so important to our society. Some of you may or may not know this, but there is a major staffing shortage all across the country in the healthcare industry, and we need our healthcare workers. They're very important. So hopefully this video will help shed some light, explain what they do, and even inspire you to maybe go out and get a job in healthcare. So to start things off, we have the most well-known role by far, and that is doctors. A doctor is a medical professional who has studied and trained in the diagnosis, treatment, and prevention of a disease. In order to become a doctor, you must first complete an undergraduate degree, followed by 4 years of medical school. After that, they must then complete a residency program, which can last anywhere from 3 to 7 years. Once they have completed their training, doctors can then choose to specialize in a particular area of medicine, with some examples being cardiology, surgery, or pediatrics. As I mentioned in my previous video, which you can find the link for down in the description below, primary care doctors are the most interacted with by the general population, and you might be familiar with them because you usually see them on a yearly basis. They provide basic medical care, but they can also refer out to specialists if more specialized care is needed. Like I mentioned before, specialists have just completed additional training in a specific area of medicine. Surgeons are doctors who perform surgery, anesthesiologists administer anesthesia during surgery, and radiologists use imaging techniques like X-rays and MRIs to diagnose diseases. The list goes on. So if you're interested in maybe practicing medicine one day, these are just some examples that might be useful for you to look into. It's no secret that doctors are super important. Their knowledge of the human body allows them to work tirelessly to save lives day in and day out. Doctors might be the most popular from shows like Grey's Anatomy or House, but let's be real, some of the most important people in the healthcare industry are our nurses. A nurse is a professional who provides care for patients in a variety of settings. They can work in hospitals, clinics, doctor's office, and they may even come to your home to provide care as well. They can provide basic care like taking vital signs and giving medications, but also more complex care like coordinating treatments and providing emotional support. We have 3 main types of nurses in this country, which are RNs, LPNs, and CNAs. At the top, we have RNs, who must complete an accredited nursing program and pass a national licensing exam. Below that, we have LPNs, who must also complete an accredited nursing program. It's just that their training is typically a little bit shorter. And below them, we have CNAs, who just have to complete a state-level exam to get certified, but let's be honest, they are some of the hardest working people in the whole industry, and I have a lot of respect for CNAs. Nurses play a massive role in this industry because they provide vital care and support to patients and act as a key point of contact between doctors and patients as well. Oftentimes working in the exact same setting as doctors and nurses, we have healthcare therapists. They typically have extensive training in a certain discipline such as physical therapy, occupational therapy, or speech therapy. So physical therapists help patients improve their physical abilities and manage pain. This is the most common and well-known discipline in all of therapy. A little bit less known are occupational therapists, who help patients develop the skills necessary for daily living. They may work more with patients who have cognitive issues or even physical disabilities. Speech therapists are pretty straightforward. They help patients improve their communication skills. So like if you've had a stroke, for example, they might help you try to regain your ability to speak. Healthcare therapists are definitely slept on, but they play a huge part in the recovery portion of healthcare. Once therapy is done with you, you might be ready to go meet your social worker. Now I'm going to focus on healthcare social workers for the sake of this video, because they're a little bit different than social workers that might function in the community. Social workers strive to improve the quality of life for those in need by providing services and support. They help individuals within hospitals or other medical settings access the resources that they need and explain the services that are available to them. They bring a real human element to settings that can sometimes be really scary and lonely. I personally have known many social workers that have had a huge impact on patients, even after they've left the hospital or the nursing home. Now, when it comes to taking medicine, there's no one better to refer to than a pharmacist. So pharmacists are critical healthcare professionals tasked with assisting patients in understanding and using their medications. As medicine advances, so does being a pharmacist, which means that you have to keep up to date with research studies on new prescription medications and staying in tune with changes in the overall industry. Sometimes pharmacists choose to work in hospitals alongside doctors and the other staff there that they have available, or they might work in a community setting like a drugstore, which you might have gotten some of your prescription medications from in the past. There are so many different avenues you can take with being a pharmacist, which is what makes it really exciting. They really help patients understand and make the most out of their medications, whether it's explaining different side effects or perhaps different drug interactions, or even explaining the right dose that you need to take. In a similar way, medical technicians also use their scientific background to contribute to their healthcare team. So medical technicians use a variety of scientific techniques to analyze specimens and diagnose and prevent certain illnesses. They might work in hospitals or medical labs where they perform routine tests such as taking blood samples, examining cells, and culturing bacteria. They use sophisticated instruments to analyze test results and note any irregularities that could indicate an ailment or infection. And that's why most medical techs end up working in some sort of lab. So if you like healthcare and science, then this would be a great option for you. Even though they often operate behind the scenes, it doesn't mean that they're not still super important. They help by analyzing lab samples, performing diagnostic tests, and interpreting those results. They're very similar to another role which works hand in hand with other healthcare professionals, which would be medical assistants. Now, most of us have actually interacted with medical assistants whenever we've gone to go see our doctor. They're usually the people behind the glass screen when you check in, and they're typically in charge of doing both clinical and administrative duties in the office. They might be taking medical histories or scheduling appointments or even administering medication. They have a lot of different roles that they take on. The mix of both the clinical and administrative side of things make it a very interesting and unique hybrid role in healthcare. And like I said, they're some of the first people that you encounter when you enter a medical office, so next time you see them, you'll know a little bit more about what they really do. While medical assistants are typically tied to an office, nursing aides are different in that they can work in a variety of settings, which typically include hospitals or nursing homes. Aides can provide direct care, such as bathing, dressing, eating, and even repositioning. They also tend to spend a lot of time with patients, so they can be one of the first people to observe and report any changes in their condition. One of the most important things that they do, though, is provide emotional support by building connections with their patients. I know a lot of aides that I've worked with in the past that really care, and in order to do that job, you have to care a lot about people. Without their expertise and compassion, healthcare facilities would be at a loss. As I mentioned earlier in the video, nursing aides must complete state-approved certification programs and become registered before they can start working with patients. This is actually a fairly easy process, so if you love helping people, I would definitely go for it. And last but not least, to round off our list, we have dietitians. So a registered dietitian is a trained healthcare professional who specializes in nutrition and the management of food. Depending on their job type, dietitians may lend their expertise to hospitals, nursing homes, public health agencies, and a lot more. They have a deep understanding of nutrition science, which helps their patients make smart choices and leads to healthier lifestyles. Clinical dietitians in particular specialize in creating individual nutrition plans that aim to correct medical conditions and maintain overall health. They play a vital role in complex dietary situations, like for example when someone has a feeding tube, and are a necessary part of any skilled medical team. So that really wraps things up as far as going over all the different types of healthcare workers. I really hope that you learned something in this video. If you want to read along, make sure to check out my blog. I'll have a link to that in the description down below. It just goes into more detail, and I've also made a bunch of shorts that cover a lot of these topics as well. In case you want to see this video just in a shorter format, I broke it down into like 10 or 13 videos. I can't remember right now, but make sure to check those out. So hit the like button, subscribe to the channel, and I'll definitely be seeing you in the next video.